Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. No monitoring system should be used as the sole basis for diagnosis or therapy, and they are intended as an adjunct in patient assessment. Reliance on a single monitoring system alone for patient management is not recommended. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on patient safety and procedural sedation. Is a team approach important? To help answer this question are procedural sedation nurse Linda Erfle, CRNA Brian Berry, and gastroenterologist Dr. Ashish Chawla.
Okay, hi Dr. Chawla and Brian. We're going to talk about the team approach, and it's important to have a team approach to prevent respiratory compromise. Our team here today is Dr. Chawla, the gastroenterologist. We have Brian, the CRNA, and I'm Linda, the endoscopy or procedure room nurse. Brian, you're doing all the sedation, and how important it is for you to make a good patient selection, and talk about what else you're going to be doing during the case that you're thinking about.
Yeah, when anyone goes under a sedation case, I think there's 3 buckets that I always think about, right? There's patient factors. Patient factors would be things like morbid obesity, advanced cardiac or lung disease. So that would risk stratify the patient for their comorbidities. And we talk about ASA classifications that classify how sick a patient is. Then the second bucket would be the area of care factor. And that would be, in this particular example, a non-operating room anesthetic or a non-operating room sedation case. That carries a lot of risk. And we see that nearly at 2 times the risk of adverse events due to patient's age and so forth. So then the third bucket is treatment factors. What is the patient being treated and how are they being treated? So are they on chronic pain medication? So they might be opioid tolerant, or maybe on the other hand, opioid naive. So those are the 3 buckets I think about: patient factors, area of care factors, and treatment factors. And that impacts how I think before I approach a sedation case. Now, Linda, let me flip this back to you. I want to know, what are a few things that are important to you as the sedation, as the endoscopy nurse in the room?
Okay, well, I know that the doctor's doing the procedure. He's focusing, or she focusing on the screen, thinking about diagnosis, what's necessary to do to get the diagnosis, working on getting to the cecum, or doing whatever we're doing for the EGD. And the sedation nurse is doing everything, giving the meds, monitoring the patient. I think you guys do a lot of charting. I'm not doing as much charting these days. I'm just doing specimens, so I can keep my eye on the patient, the monitors. I'm looking at all the monitors, the capnography waveform, the O2 sat, the heart rate, and it's all important. But I would, to be honest, say that most procedure nurses and most people that I talk to are not educated on capnography. And they really don't know what it's all about, why we have it. And, what are you thinking about the future for capnography, Brian? Like, is there any good teaching available for the procedure nurse? And what do you think is going to happen as far as education?
Well, education has to be there, 100%. If you look at the November 2023 Anesthesia and Analgesia journal, it's a peer review journal in anesthesia, been around forever, highly respected. That journal, that entire journal, essentially highlights the importance of capnography. And what the authors, say is that capnography, number one, needs to be educated to everyone. Number two, incorporated in darn near all of our areas of care. We're talking ICU, PACU, general care floor, OR, non-OR, sedation cases everywhere. And they highlight and emphasize how much more safe and effective we are as clinicians incorporating capnography into our practice. So I think it makes us give higher quality of care.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.